presentation is lymphedema and physical therapy after breast cancer. It's been, again, another hot topic that has been requested. And Stacea herself is, one of our favorite presenters, or I should say, I don't want to be biased, but everybody's always like, we love Stacea. I want Stacea. I'm coming to Stacea. So thank you, Stacea, for being here with us. So I'll go ahead and read Stacea's bio, tell you guys about some upcoming programs that we have later on in May. I can't believe that we're almost halfway through 2022. It's crazy. And then some programs in June, and I'll let Stacea go ahead and present. So early in Stacea's career, she encountered women with lymphedema following breast cancer. She felt there had to be much more she could do, or that we could do, to offer these women who had already been through so much. Stacea completed her lymphedema certification in 2000 and found a new passion treating women with breast cancer-related lymphedema and other impairments. This passion resulted in joining the BCSS board from 2001 to 2007, during which time she learned all the amazing things they offered for newly diagnosed women and survivors. She continued her specialization into cancer rehab so that she can address even more of the issues that result from breast cancer and its treatments. She has felt so blessed to have met so many amazing women and survivors and will continue to help them resume all of their energy, excitement. So again, thank you, Stacea, for being with us tonight. But as you ladies can see on your clipboards, I've got quite some papers for you. Unite for Her, as you've heard of her, I just want to remind you all, if you want to need to go through the program or know of anybody else that is currently newly diagnosed, Unite for Her is a national program that we use as a partner / resource, and we work with them so that survivors can take advantage of the programs and resources that they have: integrative therapies, acupuncture therapy, regular therapy, food and nutrition, CSAs, and stuff like that. They have virtual wellness days that you can participate in, among other things. Also, just to remind you, we do have bra and prosthesis mastectomy bra fittings with Lisa Spencer from St. Joe's. So, if you're ever interested or need a bra fitting, you can go ahead and schedule that with Lisa. Also, this is also for people who are in active treatment / newly diagnosed. Our meal delivery program, we actually have the last 3 months of the year are open. So these go by really quickly. And the chef serves with a lot of love. Some survivors have said that they've even had food left over for about a week. So the portions are big, the food is great. We have October 25th, November 22nd, and December 27th left open for 2022. So please take advantage. If you would please. What was that?
No comfort bags, no meal delivery. I started out in dark ages.
Oh man, I'm so sorry. Hey, you help bring the light, right?
Right.
Yeah, there we go.
Good thinking.
Hey, I try to think on the spot sometimes. I've learned. And then this is the handout that Stacea will be going over with us today. So again, if you have any questions, how the presentations with Stacea go already. And then this pink paper right here is if you guys want to take notes. I know a lot of the survivors or people who come to the presentations like to take notes on the program, so feel free to take any notes, ask any questions, and of course the survey. And the last thing I will really stress and continue to emphasize: every program, please, it really benefits Nina, Rowley, and myself. Me as a program coordinator and Nina as the program chair. We really like to know what you guys are thinking, what you like, what you dislike, what you think is so, what you think is excellent, not so excellent. We want to hear from you. We want to know what program topics you want in the future, whether it's in 2023, almost 2024 at this point that we're planning out that far. So, please be as honest as you can and let us know what you think of tonight's program, but also what program topics you want us to discuss or have for you in the future. So thank you, ladies. Welcome, Stacea.
Thank you. I did update the handout. My email is finally on the top because every time I do this talk, I say, didn't I put my email up there? And then I'm like, oh, I didn't put my email. Now you have my email. the easiest way to get hold of me is to email me. I work full-time. I'm with patients almost every minute of the day other than when I'm eating lunch. So if you email me, I can get back to you really quickly. I check my email throughout the day between patients. I can answer any questions, get back to you, let you know whatever it is that you needed to know. If you call me, that's fine too. At the hospital, I didn't put my phone number on there. Can't call me. If you have my number. If you do call, I try to call everybody back within 24 hours. But if you call in the afternoon and I am booked solid with patients until 7 p.m., I'm probably not going to get back to you until the next day. If you call me and I haven't called you back in 24 hours, I'm either off and they didn't tell you. Some of our office staff will let you know she's off this week. And some of them are a little excessive about, well, I didn't want, I wanted to respect your privacy. I'm like, please tell my people that I'm off, not ignoring them, because I just think that's common courtesy. We now have 2 front office staff that are there almost all the time, and they know us well. So even when I'm sick, I'm like, just tell them I'm sick. You're not canceling them because I didn't feel like seeing them. I'm sick. Thankfully, that doesn't happen very often. It's getting less and less often thanks to now we're in an endemic instead of pandemic. All the demics. Okay, so I'll just briefly go over all the things that we do in our program, and then we'll talk mostly about lymphedema. I know a lot of you have already heard me, so we don't have your handout. No, where'd she go?
Or pink sheet.
No, it's a white.
No, but she talked about a pink sheet.
Pink sheet.
For notes.
That's just,
This would be a note.
We don't have.
Let me
You
see.
We
don't
don't have the handout.
No, I
Oh,
don't.
my. Okay, I'll go get.
I didn't bring any because she told me she was printing them.
That's fine.
We're 2 handouts short.
yeah.
Oh,
You
Oh,
don't
yeah.
have those? No.
3 handouts short.
I don't need one.
Okay. I'm sorry.
Oh, that's fine. Because I know, where's her email address?
I did not give it to you, sorry.
You're not allowed to have it. Well, when she said you don't
Yeah,
have my
where
number,
is it?
somebody probably warned her.
There's the email address. It's at the top.
It's right there. I put it in bold underneath my stuff.
Mine
You have an
doesn't
old handout.
Oh, do you have a new handout?
You don't get my email either. I'm just teasing. I can give you the phone number to our front office if you're somebody that would rather call. Just know that I won't get back to you quite as quickly, but if you'd like that, I can certainly give you the phone number.
That one has it.
And I know they have it here. So I am a physical therapist by training.
Okay.
There are 6 of us on my team, 4 of us are full-time, and then we have 2 that work 1 day a week, other than Dale Marie, who is working 2 days a week this week. And I'm like, why is she back in on Wednesday? I love her to death, but I'm like, you're retired and you're still working a lot of days. And we are all physical therapy based. We have 2 physical therapy assistants. One of them we got to steal over from St. Joe's when they closed their program. And then the 2 PTAs, and then 4 of us are physical therapists by training. We are now more than fully staffed, and our wait time was really nice and short. I think the wait time to get in for a new eval might be 5 days unless you want to see me. Yeah. I think I have openings in June, but that changes all the time. So I have patients that are in my schedule that requested to see me, and if they get a cancellation, Miss Kay Kay is our primary, but now Erin is also, she will call you to offer earlier times. Okay, so what do we do there? When you come in for an evaluation, we're looking at a lot of different things, not just lymphedema. And we have patients that come in who may have lymphedema or think they might have lymphedema in their arm. But we're also looking at what's your scar tissue look like from your surgery and radiation. Did you have, how many lymph nodes did you have removed? Did you have lymph nodes removed on one side, both sides? We're seeing a slight increase in, at least I'm seeing a slight increase in younger women diagnosed who have had either a micro tumor in one side and then more than a stage 0 breast cancer in the other, and they're having sentinel node biopsy done on both sides. So we need to know all of that so we can give you the proper precautions and we can address both sides the way we want to appropriately. So we look at your range of motion of your shoulder. We're just talking about breast cancer. Sometimes I kick into normal PT stuff, but not normal. My normal PT stuff, I'm not a normal PT. Haven't been one for 22 years. But I'm looking at range of motion of shoulders primarily, but also how is your spine moving, if there's an issue with that, if you have kyphosis, because we all tend to get this way the older we get and everything we do is in front of us. Some women come in and they have a pre-existing neck issue, so we have to look at everything when you're there. If there's limitations because of scar tissue, we want to address those. And that doesn't mean if you had your cancer treatment 5-10 years ago and you still have range of motion problems, that doesn't mean we can't help you. I've had women come in and they're like, oh, but my surgery was so long ago. And I said, well, let me see how you move your shoulders. Oh, it's no problem. And I'm like, well, that's a problem. So it's never too late to help with range of motion problems, which is good. And then that turns into better lymphatic drainage, better postural alignment, better strength, less problems, less pain in the future. We look at your strength, primarily of your arms. If we have a patient that comes in and they're having lymphedema of the arm, and then we are required as physical therapists to screen everyone for falls. So if somebody comes in having, and we need to see them for lymphedema, but they're a high fall risk or they keep falling, their balance is a problem. Maybe they have chemotherapy-induced neuropathy. Many of you may know what that is. We may then co-treat with one of the orthopedic PTs so they can treat leg strengthening, work on balance and everything. I talked about range of motion. Posture is important for every human. So we look at that, and if you've had breast surgery on one side, you tend to have asymmetric pulling on the side of surgery, which then causes postural problems, neck pain, back pain, can lead to a lot of other problems. So as PTs, we do look at everything. Scar tissue treatment is a big part of what we do for every patient that comes that has had surgery and or radiation. I haven't had many patients have only radiation for breast cancer. I get patients that have radiation for neck cancer and no surgeries, but I'm trying to think of a single patient that I had that didn't have surgery, and I can't think of one. So surgery causes scar tissue, radiation causes scar tissue and fibrosis of your tissues. And I used to say we are all trained, but we're not all trained. Right now, 4 of the 6 of us are trained in techniques called myofascial release. And we work on releasing the scar tissue connections or adhesions. People have heard that term a lot from your healthy tissues. That allows you to move your arm more freely. If you have a surgery on the side that has lymphedema, then we will also work on that scar tissue, because even scar tissue from a carpal tunnel release or a forearm surgery, that'll block drainage downstream. So we work on that. And even if we've already treated you, a lot of times patients come in for tune-ups. That's what I call it anyway. Coming back for a tune-up. Wound management, hygiene. I talk about that a lot with the newly diagnosed group, because sometimes your mastectomy, partial mastectomy, axillary node or sentinel node incision doesn't heal right away. I actually have a couple young women that are very, very thin, and every time they try to stretch, they open their incision. So we work with the doctors to try and get those wounds to heal. We do wound care when needed, but usually we're referring for true wound care at the wound care center if you have a wound that's not. So what are lymph nodes? A lot of times people call them their lymph glands. Those are those little things that you can feel when you're sick. They get all swollen. They're under your arm, as you all probably know. So lymph nodes are little filtration systems. They are tissue that filters out bacterial cells, viral cells, broken cellular components that are in your body, and cancer cells. And that's why they take them out, sample them. Nowadays, yeah, right. Nowadays, it's much less common to have a lot of nodes removed. However, I have very recently been getting an influx of new patients. One had 35 nodes removed. One had 19 positive nodes out of 27. When I see those numbers, I just go, ooh, good thing you're here. So the majority of patients are being diagnosed. The majority of women are being diagnosed earlier so they can do sentinel node biopsies. The research shows that even if the sentinel nodes are positive, that there's equal survival rate to doing chemotherapy and radiation instead of going back in and taking out the remainder of the 30 nodes. So the patients that I've gotten recently with the huge numbers of lymph nodes removed are not from our facility, which is why I'm not used to it. But nonetheless, it's still being done in some places. So a woman who has 3 lymph nodes removed and radiation directly to her armpit because maybe one of them was positive, that increases her risk of lymphedema. But a woman who has 30 lymph nodes removed, 27 are positive, and radiation to the axilla, she has about a 90% chance that her arm is going to swell. So those patients, thankfully, the doctors all send them really quickly to us. That never used to be the case. It used to be, well, we'll wait and see if you swell. And if you swell, then we'll send you to the team. But now we get women, I've gotten women 10 days post-op. And I'm like, okay, well, I can evaluate you, but I'm not doing anything. I'm like, I can't mobilize you yet. You're gonna come back when you heal. But it's really good that we're getting them a lot sooner. So what is lymphedema? It's an abnormal accumulation of lymphatic fluid in the quadrant affected. So for ease of conversation, I'm going to mostly refer to if you had surgery on one side. So you had lymph nodes removed on the right side. We'll use the right side as an example. So that puts the right upper quadrant at risk for swelling. And that goes from your collarbone down the center of your body to your waist, basically at the level of your belly button, front and back. That includes the arm, the chest wall, the side. Women who have partial mastectomies and are larger breasted have a higher incidence of breast lymphedema, which a lot of women don't realize right away that they could get breast lymphedema and not arm lymphedema. I have, it seems to go in clusters, and I think that happens in a lot of the breast cancer arena. Like when I sit during the conference part of multidisciplinary breast clinic, it'll be like today's left day. Like every woman they have, all 8 of them have left-sided breast cancer. It's just, it's interesting, and I don't know scientifically what that means. But so if you have a partial mastectomy and radiation to the breast, there's a higher incidence of breast lymphedema, but it doesn't always cause arm lymphedema. If you had a partial mastectomy and you had 30 nodes removed under the armpit and you had radiation to the entire breast, this area called the supraclavicular fossa and the armpit, now you're at a high risk of breast and arm lymphedema. So those are all the things that we look at. What is the cause? The simplest definition, the simplest thing I can tell you is anybody that has permanent damage to their lymphatic system is at increased risk of lymphedema. Now define permanent damage. Can I tell you if you've had permanent damage? Probably not. If you've had a sentinel node biopsy, did not have radiation directly to your armpit, you may or may not have had permanent damage. You have a slight limitation in your lymphatic system, but that doesn't mean that you absolutely will swell, which I like to say this here and I'll say it again later. There's still, I'm surprised, after I've been talking at you poor ladies for 20 some years, there's still a misunderstanding with a lot of women, especially women that come to me and they're newly diagnosed. You can develop lymphedema at any time if you've had permanent impairment to your lymphatic system. So somebody who's had a lot of nodes removed plus radiation directly to the axilla, we can probably say you have permanent damage. So you're at risk forever. Somebody with 1 or 2 nodes removed, no radiation to the axilla, your risk is minimal, very minimal, but I still tell those women, please do not let them take a blood pressure on that side. Because I have had 9 patients now, I keep track of that in a different little folder at work, 9 patients who had sentinel node biopsies, no radiation, 1 blood pressure on that arm, and their arm swelled. Was it a big balloon? No. Did we manage it nicely? Yes. Do they now have lymphedema forever? Yes. So no blood pressure on the side you've had lymph nodes removed. If you've had lymph nodes removed from both armpits, thigh or ankle cuff, every nurse that graduates from nursing school knows how to take a blood pressure on an ankle and a thigh. They don't like to do it. It's not as easy, but they know how to do it. So I am a huge proponent of you, anybody at risk, telling the nurse you cannot use either arm. I've had patients come in and they're like, well, I had nodes removed on both sides, so they just alternate arms. They take the blood pressure. I'm like, okay. I try not to go.
Shouldn't the nurses know that?
They do. They should know that. Yes. There's also a procedure in place at Tower Health that doesn't get followed. It used to, yeah, it used to get followed really well, and then, you know, the size of the organization exploded, and we have multiple hospitals. And I am not a nurse's friend if they take a blood pressure on a patient at risk, because I want names and my chart ethic. You don't have to remember the name of the nurse that took your blood pressure because it's in the chart, and I call them. And I'll be like, pretty sure you're supposed to ask every patient that you take a blood pressure on, is there any reason I should not use this arm for blood pressure? Because a lot of times you might be nervous, you might be stressed out about the appointment, you might just be chatting with the nurse because you haven't seen her and you know her. I have a lot of patients, and I would say of the 9 that had a blood pressure taken, all of them, they just weren't really paying attention because they know I'm in good hands. So they're not going to do something that harms me, and they don't do it on purpose. And then they're like, oh my God, you took a blood pressure on my side that I had nodes removed. They're supposed to ask you, because you're never going to forget. If somebody's putting a blood pressure cuff on your affected arm and they say, is there any reason I shouldn't take a blood pressure on this side? You're going to go, oh, no, you can't use that arm, no matter how distracted you are.
It was 20 years ago when I had my Forticat removed. I was in the surgery center. Okay. I had a sign on my bed, a
big
bracelet on my
pink
arm,
bracelet, yes.
and I happened to wake up before, and the nurse was coming. She's putting the cuff on my arm, and I'm there like, "Can't you read?" Oh, it does matter. I said, "Yeah, it does."
See, those are the nurses I call. Hi, I am not your friend. You're not going to want to talk to me ever again. But let me just tell you about you. So I get really upset because it's really not that difficult to be cognizant of this. We used to have a flag on every woman's chart that had nodes removed, and it said no blood pressure, no IVs on right arm. Then they did epic rebuilds and it got removed. No matter how much I argue, it's not back on there. So just be aware that even if you have your bracelet on, there's a chance that conversation ensues and they're not thinking. And I can tell you from a healthcare professional standpoint, you had right nodes removed. I'm looking at you, that's your left arm because it's my left side. So we all still, you're not thinking. So they're not necessarily doing it on purpose, but sometimes I will say to patients, oh yeah, your other left. I'm going to work on your other left. because I'm on the wrong side. Okay, so what are signs and symptoms of lymphedema? I recently was reading actually a blog of a lymphedema expert, somebody that's very knowledgeable in lymphedema, and she said I have stage 4 lymphedema, and I'm like, did they restage? I literally questioned myself because it was on this big blog, and I'm like, there's only 3 stages. There are 4 stages, but stage 3 is the most severe. Stage 0 is the latency stage. So I think she just got confused because there are 4 overall stages. But stage 4 lymphedema, I'm like, maybe that's in Europe? No. So I couldn't find any articles. I searched the German literature, which lymphedema treatment started there. Nowhere. So I'm like, okay, I'll change whatever I'm saying. So stage 0 is the latency stage. Your lymphatic system has been damaged. You may have extra lymphatic fluid in your breast or your arm, but I couldn't measure a difference. And I may or may not be able to feel a difference. You will feel a difference if you're really into it. It feels heavy and achy. It looks the same. You can do the down and dirty test that I usually teach patients. Make a fist. Look at your hands. You have peaks, you have valleys. If you lose your valleys, you have swelling normally. If you never had valleys, you don't have swelling. But they should be, like, mine are not completely symmetric. Yours won't be either. But normally you can see your bones, and then you can see the little dips in your hands. If you have a lump, a hump, or you look and, oh, look, my hands, I have manual therapy hands. I have tendons, I have veins, I lift weights. If my hand looks really smooth and looks like I'm in my 20s again, I probably have swelling in my hand. It's not a good thing. And the other way to do it is if you stand in front of a mirror and bend your elbows, you have a contour. You should be able to see your little bony elbow. Everybody's different. So it might just be a little point. It might be a big point. If you're looking in the mirror and this one is pointy and this one is round, you have swelling. So those are ways to monitor without getting a tape measure and trying to measure yourself. Unless you fall on your elbow onto a concrete floor and swell, and then it doesn't count. Thanks. You're welcome. She told me I could throw her under the bus. I mean, she said I could use her as an example.
I did.
She sure did.
I did on last Thursday. I was planting pots, and I have one of those little carts that you can sit on, and you can put your tools in. And normally when you face it, you sit on it, it's like this, and you're sitting this way. And I turned it this way, so when I sat down on the end, the other one end went whoop, right out from under me.
And of course she fell on my arm.
Yes, I did. So I have a very, very.
If you're in active treatment, it's my arm. You're not supposed to hurt it. So
Yeah, it's a very, very lovely.
got to yell at her.
No, it hasn't gotten yellow yet.
No, I said I got to yell at you.
Yes, you
I
did.
got to yell at her, not yellow at her.
Yes. Well, I told you, Grace is my middle name.
All right. Stage 1 lymphedema. Sometimes you still see it referred to as spontaneously reversible. We have tried to get rid of all that terminology, but I still like to bring it up because I've still had women ask me. So stage 1 means it comes and goes. You get up, your arm might look perfectly normal in the morning. By the end of the day, there's a little swelling. It's heavy. If you elevate above the level of your heart, the swelling goes away. But this cycle continues where it looks normal in the morning if you don't work nights. Let me rephrase that. So when you sleep, your body reabsorbs fluid and equalizes, and the lymphatic system works at fluid balance. When you're up moving and doing things is when the fluid comes out of your bloodstream into your tissues and can accumulate. And if your lymphatic system is not picking up the fluid as quickly as it used to, that's when you swell a little bit. So that's stage 1. It doesn't usually last more than a couple weeks before it becomes early stage 2. It improves overnight, but not completely. It swells during the day. If you elevate, it gets better, but not normal. That's early stage 2. Stage 2 is a huge spectrum. And they've talked many times about dividing it into more stages, which is why I was like, oh, there's stage 4, we must have split, but we didn't yet. Mid stage 2, it's always there. Stage 2 is when, if you're sitting at movies, you're sitting somewhere, resting your arm, and you pick it up, you have a huge dent. Stage 2, that's called pitting edema. Late stage 2, it's harder. It feels a little more like this a little bit. It gets a little more fibrotic. It's harder to create those dents. And when you get them, they stay longer because it's a deeper swelling. And then stage 3 is lymphostatic elephantiasis. It got that name because the skin changes texture. Thankfully, in 22 years, I've never seen stage 3 in an arm. And I have had patients who had Halsted procedures where they removed the entire chest wall, like everything, down to the ribs and sometimes some ribs. That's what they used to do for breast cancer. Every lymph node they could find, like you are rib cage and skin, that's it. And those were big, big arms, and they never got those skin changes, thankfully. So stage 3, you will see in the legs. I think we're all old enough. I don't know who all's online, but if you ever looked at the Guinness Book of World Records and the Elephant Man, he had stage 3 lymphedema of his entire body. That's what his problem was. The real miracle is that he lived past the age of 2 because the lymphatic system does 2 things: fluid balance and infection fighting. So when you have lymphedema, you're at a higher risk for infections. And most infants actually that are born with lymphedema of their entire body don't live very long. They usually die of a pretty severe infection somewhere. Any questions so far? I like this to be a little more informal, so anytime you have questions, just ask. You don't have to wait till the end. Okay. Are Zoomies? No? Okay. So what do we do if you come to us for lymphedema? I already talked about, we treat scar tissue on every patient. We have found that doing myofascial release improves lymphatic flow and drainage out of the arm and the breast. So we treat everybody with scar tissue work in addition to all of the complete decongestive therapy things. So complete decongestive therapy includes meticulous skin care, manual lymphatic drainage that feels amazing usually, bandaging if necessary. Nobody likes it, but it works really well. Fitting you with long-term garments. It's so funny. I had one lady go, garments? This isn't like 1920. We have compression arm sleeves, we have gloves, we have ferro wraps, we have the gamut. So we just call them garments, blanket term. Like, yes, and we wear blouses. So there you go. So manual lymphatic drainage is a very gentle massage. The lymphatic system does not have a central pump like the vascular system. So the blood vascular system gets moved through the body by the heart and the lungs to some extent. The lymphatic system has smooth muscle in the walls of the cells that pump the fluid along. It's not a closed column of fluid. Most people understand or have been told, like if you have a pocket of air in your bloodstream, you're in trouble. You're going to have a pulmonary embolus, you're going to have a stroke, you're going to have a heart attack because there should be no air in your blood system. In the lymphatic system, there are lots of pockets of air. It is not a continuous column of fluid, which is a good thing. We use the massage to take advantage of that. We create suction, so to speak. We increase the activity upstream of the swelling. So if we're talking about arm lymphedema, well, it doesn't matter where your lymphedema is. We start at the neck if you have severe lymphedema. And we stimulate the lymph nodes here, but we're actually just stimulating the blood vessels and the lymph nodes surrounding it. So you have huge your huge veins that run here, all of your lymphatic fluid dumps into your veins to be recycled, which is why it's important that all of your lymphatic fluid be filtered through lymph nodes, because you don't want bacterial cells, viral cells, and cancer cells getting into your bloodstream and having free reign of your whole body. So we start at the neck, and then we'll work the trunk. We teach diaphragmatic breathing, and then we even though you've had lymph nodes removed under the arm, we still stimulate whatever lymph nodes are there. Even in the women that came in with 30 nodes removed, I'm still going to try and stimulate. They may have had 50. We don't know. I don't think I said that earlier, but the average number of lymph nodes under your arm, they say, is 20 to 30. That's based on white men, of course, because everything's based on white men. And we're not white men. None of us are white men in this room, but we don't know. So some women, they have looked at female anatomy, thankfully, and some women have 5 lymph nodes under their arm and some have 50. So you're somewhere in that range, but we don't know. There's a study called a lymph angioscintigraphy, and they've updated the way they do it so it's less painful. That's the only way they would be able to know. Go in and look and see how many nodes you have, but they don't do that. If you develop lymphedema without surgery and you have absolutely no clue why, then they do that test to see where your blockage is. But we stimulate those lymph nodes. There's been very recent research in the past 2 years that has, I'm very research based, and I like to base my treatments on research. So 20 years ago, I was trained a certain, what's the word I'm looking for? Yeah, well, yeah. It's a certain order that you move the lymphatic fluid. So if you're treating right upper lymphedema, you start at the neck, then you go to the left armpit, and then you work the fluid across the anterior chest wall, the front. Then you work the lymph nodes in the groin, and then you move the fluid down before you even touch anything else. The recent research, and they've studied over 1,500 women who've had breast cancer, they have not seen in a single woman the lymphatic fluid going across to this armpit or going down to this groin.
So for 20 years,
So
you're doing nothing.
I don't know that we were doing nothing. We were stimulating the lymphatic system, which boosts your immune system. And if everything's flowing everywhere else, maybe you were making a difference. I don't know. I can tell you that you will still, if you Google manual lymphatic drainage, you will still see that that's the pattern. My newest PT just went to training through close consulting where I went to training. They still teach that pattern. And then they say, now recent research doesn't support this pattern, but they're still teaching it. So I'm a little more, I don't know the word for that either. I'd like to say proactive. I'm a little more stubborn in my own ways, in that if 1,500 women you've looked at and you've injected dye and you don't see it going there, why am I wasting any of my time on your body not helping you, is my philosophy. So I focus on the quadrant effective. I have educated, we have lymph team meetings. Some of us follow my thought process and some of us still do the other, and that's fine. I've told them my opinion, and that when I treat, if they evaluate a patient and they're treating that patient and I have them, I'm not wasting my time on the upper armpit and the groin. I'm just not doing it. I'm going to spend all my time in the upper quadrant, and I've seen better results. I see faster decongestion. So if you are online and looking at lymphedema from any sort, you will see that those are the patterns. And if you come to me, you will see and feel, I don't do that. I don't spend time on the other side. Now, if you've had surgery on both armpits, I'm going to spend time on both. I'm going to spend time on both sides, because then it's important to stimulate both sides. But that's a little blurb on how my treatment has changed over the years. So compression bandaging. It is like a soft, bulky cast. We bandage your fingers individually with gauze. Then we use cotton padding. We use foam. We basically take your swollen arm and make it really big to make it really small. So the bandaging works beautifully. Now we could massage you every single day. And if we didn't bandage you, it wouldn't be as effective. You probably would not see the fluid reduction. And our whole goal is bandage you, shrink you down, get you into compression, arm, sleeve, and glove for daytime, and then see if you need nighttime compression. There are different options for nighttime. I do have some women that bandage themselves at night. I have some women whose husbands bandage them every night. We have things called ferro wraps that are Velcro devices. I should have brought all my goodies and I didn't bring my suitcase. So there's other nighttime options that are a little more similar to compression bandaging. You cannot sleep in arm sleeves and gloves. Some patients will do it anyway, but their compression arm sleeves and gloves or gauntlets that come across here are high stretch. They're more like an ace bandage. So they can cut off your blood flow and they can cause some numbness and tingling in your fingers. They also typically will not shrink down a swollen arm and hand, but they will hold you where you are. So we bandage you to shrink you down and then get you into garments to keep you shrunk down. Women that come in and have a pretty significant lymphedema in their arm, they're probably going to be wearing compression. I say indefinitely. I think it sounds a little less awful as forever. Because every time I say the word forever, I think of what's the movie where the kid goes forever. Anyway, I'm just like indefinite. And they look at me and they go forever. And I'm like, indefinite. Maybe something will change. Maybe there will be a new discovery. Maybe there will be a Dr. Granzow surgeon who is being very successful with lymphatic surgeries. And then you still have to wear compression. So, we teach you exercises. They're basically range of motion to get the lymphatic fluid pumping, and you move your body in the same order as the massage, which as you can guess, probably, my exercise program has changed because I'm not treating the same things. Like I'm not going to make you move this arm. But if you have tightness on both sides, then you might as well move both. Diaphragmatic breathing is one of the best things every person, every human alive can do. We are the only country that walks around holding our stomachs in because we want a flat stomach. And what we actually do is we minimize our lymphatic drainage. We minimize our lung capacity by not allowing our lungs to drop down into our abdominal cavity and fully expand. So we vain Americans actually reduce the effectiveness of our own lymphatic pump, the diaphragm. So diaphragmatic breathing, if you know what it is, you should do it throughout the day. Meticulous skin and nail care. I said one of the main functions of the lymphatic system is infection fighting. So are you going to get a cut on your hand? Probably. It's gardening season. You're going to go out and play in the dirt. What's in the dirt? Bacterial, viral cells. Where are you most likely to have openings that you don't even know you have? Your fingers. We get them all the time. Little micro tears. So meticulous skincare. If you have right upper extremity lymphedema and you're going to garden, I'm going to strongly encourage you to wear a gardening glove just on your right hand. I used to think, why would you want to dig in the dirt without gloves? And then I bought a house that has a lot of gardens and I'm like, oh, I get it now. So you want to wear a gardening glove that is very protective and washable. Or if it's not washable, then you need to get the little cotton liners to put in them, because I learned early on, I'm like, you must wear a gardening glove. And then the patient got an infection and I'm like, were you wearing a glove? She's like, yeah, I always wear the same glove. I'm like, do you wash it? She's like, no. then don't wear the glove if you're not gonna wash it. So just putting your hand in a dirty glove is probably not any more helpful than just shoving your hand in the dirt. Just keeping an eye on cuts and scrapes. You know, the most common things that happen to our hands are burns in the kitchen. I'm the queen of, let me just grab my dish towel and pull things out of the oven. Stupid. I burn my hands all the time, and the pot holder was right there. So burning your hand or your arm decreases your antibacterial defense of your skin. Your skin has an acidic pH. It's natural and it works on infection fighting. When you burn your skin, you lose the acidic pH until that skin heals. So you're at more risk of infection where the burn is. Same thing with a cut. Obviously, it's an open invitation for bacterial cells and viral cells. We teach you everything you need to know to take care of whatever your problem is. So if you have lymphedema, we teach you how to put your garments on, how to wash your garments, how often to replace your garments. That's the most common thing that people forget. It takes a couple times. I chuckle because I have little handouts that I give my patients when it's their first time through for everything, including if I give you a Ferro Wrap, you need to wash it at least once every 5 to 7 days. And then a lot of times with new patients, they're doing great. I've rechecked them. Okay, I'm going to see you in 4 weeks. Okay. They come back. I don't know. My Ferro Wrap's not working. My arm's swelling up. My first question now is, when did you wash your Ferro Wrap last? Oh, and so to wash it? That's the most common thing I hear. I'm like, yep. How about you do that today? It'll be effective again. So all of the garments stretch out and become ineffective if you don't wash them. A lot of patients have the thought process, well, if I wash it too much, it's going to wear out. But actually the skin, the oils in your skin will cause it to wear out faster if you don't wash it. So ideally, highly active women should have more than one set of garments, but insurance does not always make that possible because insurances don't like to pay for anything, especially garments. They will pay for treatment, but they don't pay for garments in general. Medicare doesn't pay for anything. They pay for treatment. And they'll pay for a compression pump sometimes, which I'm not a huge compression pump person for upper extremities unless, for the arms, sorry, unless you're unable to pull your own compression on, you're doing absolutely everything you're supposed to do, and you still have some swelling. And then there's 2 pumps now. One's called the Lymphopress, and they have a chest component. So it's not just shoving the fluid up your arm. It addresses everything. I don't see huge decreases in swelling with the use of the pump for the arms. But if a patient really needs just one more thing to try and make it more effective, I will add that. I already talked about no punctures or blood pressures on the extremity.
Also, when you go to have your nails done, I always take my own tools with me.
Do, yeah. I have a lot of patients that do get manicures all the time. It is imperative that you know that those tools are clean. The salon that I had been going to, they autoclave all of their tools, and she or he, they're always like, they show it to me, and then they break the seal and they open it, and I know it's clean. But yeah, there's a lot of salons that just pull their tools out of the drawer and start cutting on you. It's like, I think I'm leaving now. That's an increased risk of infection. You can still get your toes done. Just don't get your toes done. I don't like to get my toes done at those places.
Also, are you supposed to stay out of like saunas?
Okay, so there is this long list of precautions or risk reduction. It used to be called prevention precautions. It's your last page. There's a lot of things on here. I basically, because it can be overwhelming and it may be overkill. So it talks about all the things to minimize your risk of infection. It talks about avoiding extremes in temperature. Saunas are dry heat, less likely to flare up lymphedema. If you get in a hot tub that is really hot and you submerge, you're raising your core body temperature. you probably will have some increased swelling. I have a patient who has a hot tub and she absolutely insists that she's going to use her hot tub. And then she's like, my arm swelled up. I'm like, really? I'm very sarcastic. So she's funny. I also talked to her about salt and she's like, well, let's see what I ate last night. And I'm like, oh my God. She's funny. So I'm like, yeah, you had your salty meal and you went in your hot tub. Of course your arm's swollen. What'd you do about it? So
Can you minimize it by just being in it partially, having your arm out?
if you submerge to the waist, it doesn't raise your body core as much, your body core temperature as much. If you're not going to submerge your arm, wear your compression. Yeah. Or just lower the temperature a little bit so it's not so blooming hot. I mean, some people have their hot tubs really hot. I get it. I understand the philosophy. I'm not even pre-menopause. I'm not a hot girl. Like I don't like to raise my temperature other than lifting weights. I hate saunas. I can't breathe. So these are all guidelines, but the absolutes that I tell every woman is no blood pressure in your affected arm and no IVs. So it says no needle sticks. That's the increased risk of infection. Like I've said it so many times, I'm very sarcastic and I like to be silly at times. I'm like, unless you're having your blood drawn in a back alley, you're probably not going to get an infection from a needle stick. So sterile technique for blood draws. If you're having pain from a tendinitis, if you have any type of musculoskeletal pain that is becoming more chronic, get a cortisone injection. Even on that side, I've had many doctors that are like, well, I can't give you a shot because I'm like, no, please do, because that chronic inflammation will overload your lymphatic system and cause worsening swelling. It's better to have the cortisone injection in a sterile environment. You're not going to get an infection. It calms down the pain and inflammation, and it minimizes the increase in swelling. I've had women who have full-fledged lymphedema. They've had it for years. They have carpal tunnel release. They swell up a little bit. We bandage them. We shrink them back down. They're fine. It used to be, oh, never have a surgery on that side. If you have to have a surgery, have a surgery. You just have to come back and see us, and then we'll take care of you again. Being active, minimizing increasing your hydration. If you don't have congestive heart failure and you don't have kidney problems where your kidneys aren't functioning properly, drinking a lot of non-carbonated fluid every day flushes toxins and it maintains a fluid balance. I still have patients come in and they're like, well, I started swelling, so I backed off on my water intake. Well, that's the opposite. A dehydrated person will swell. So people that are severely dehydrated swell all over because the body is clinging to every molecule of fluid they can. Maintaining good hydration. It's shocking. I have a lot of patients, they'll come in, they'll be like, I'm like a camel. I don't drink all day. I'm like, well, you need to start. And just increasing their water intake every little bit every day makes a huge difference.
You said non-carbonated. I drink seltzer.
It doesn't actually hydrate you.
Doesn't it?
No. So I say non-carbonated. I'm not anti-carbonated beverages, but they don't count towards your fluid intake. So the optimal fluid intake for every human is half of your body weight in ounces of non-carbonated fluid. So 8 ounce glasses works great if you weigh 128 pounds. I weigh a heck of a lot more than that. And I drink a lot more. I never go anywhere without water bottles. And my water bottles are all 33 to 48 ounces. And I drink 3 of them a day, bare minimum. I've had patients say, yeah, but can't you drown if you drink too much? Only if you drink like 5 gallons all at once. Yeah, no, you're not gonna drink
water. Might as well give up life, just sit in the bathroom.
I know. Yes. Yeah. But if you're taking a water pill, it's for usually high blood pressure or congestive heart failure. If you're taking a water pill for congestive heart failure, do not drink half your body weight in ounces. I said, unless you have congestive heart failure or kidney. Yeah. If you have a heart problem or kidney problems, the doctor should have you on fluid restriction because you can overload your heart or your kidneys. So that's part of my eval process. If you come to me and you're my patient, I'm looking at your lab values. And if I see an elevated kidney enzyme, if I see elevated cardiac enzymes, I'm like, do you have a kidney doctor? Do you have a heart doctor? I want to talk to them before I do anything to you. I want them to know you're here. I want them to know I'm going to move fluid into your bloodstream. Because that's where the fluid goes. And if your kidneys can't handle it, then it'll overload your kidneys and you'll get really sick. If you have congestive heart failure, it's actually less critical. Like if a patient comes in with congestive heart failure and they're pretty stable, they haven't been hospitalized with fluid overload for a couple of years, I can work on them. I can shrink them down slowly. I am very cautious. And then I'm constantly, if you feel short of breath, if you feel like an elephant sitting on your chest, if you feel yucky, get the bandaging, get the compression off. But yeah, no, you should not drink every body weight ounces.
Thank God.
But you should drink more non-carbonated fluids to hydrate your tissues. Yeah. Okay. So extremes of temperature, they just talk about the up and down. I'm going to talk about flying, air travel, because it's one of the other most common questions I get. Should I wear compression when I fly? My answer, it's like the standard medical answer, maybe. Maybe you should. If you are at a moderate risk for lymphedema, if you've had radiation directly to the axilla, if you've had more than 2 to 3 lymph nodes removed, I'm probably going to be encouraging that you get compression to fly. If you've had sentinel node biopsy, no radiation to your axilla, I'm going to explain to you that it's not required. You don't have to have it. If you are a person, if you are a woman who knows yourself well enough that if you fly and you swell, you're going to kick your own butt the rest of your life, then I'm going to order compression garments for you. The thought process goes, there's 2 theories. And Gunter is the guru that was trained by the doctors who developed all of the lymphedema treatment. And his philosophy is, if you've never swollen, your system is accommodating. It has adapted and it's keeping up with your fluid balance. Should you compress a system that's working? That's his thought process. So I start with that basis, but then I look at you. How many nodes did you have? How much radiation did you have and where? Do I see, like, do you have some, are you one of those people that scars horribly and I'm really working hard to loosen up your scar tissue? Are you flying to Australia? Are you flying, how long is the flight? If you're flying to Florida, you've never swollen, I'm not gonna be hard pressed to tell you, you absolutely have to work compression.
Stacea, Stacea, it's Carol. Yeah, I just want to interject because I didn't get my lymphedema 3 years after I had my mastectomy, and I had flown just before I got lymphedema, was diagnosed with it.
Mm-hmm.
Nobody told me about flying and lymphedema because I wasn't in lymphedema PT at the time. So
Right.
If you could pass that word to the docs, I didn't even think about getting lymphedema. I thought about it, but nobody ever told me until after you did.
The nurse navigators are really good about letting the patients know. And actually, the radiation oncologists send me more patients than anybody these days. If a patient has had nodes removed before they even radiate them, they're like, you need to go to the lymph team.
See, I was 13 years ago.
Right.
Yeah.
Yes.
Yeah.
So
Yeah.
we
Yeah,
haven't
totally.
removed that.
Yeah. Oh, good. Okay.
Yeah.
Thank you.
The one doctor always says, I don't want to tick Stacea off, so I'm sending you over. I'm like, okay.
You mean they come over before? They come for
Yes.
to you before? Oh, wow. That's great.
Basically, I am seeing almost every woman that has more than 2 nodes removed. And if they need radiation, we're getting them.
Boy, yeah. Yeah,
And
I had 3
sometimes-
nodes in radiation.
Yeah,
Yeah. Okay, good. Well, I'm glad that things have changed.
they have, thankfully, yes. The one doctor also, he sent a patient over and she really didn't have any deficits. And it was one of those, she's like, I'm not really sure why he sent me, but he told me you're going to teach me exercises so that I'll never get lymphedema. I'm like, okay, well, it doesn't really work that way, but all right. Like, I can teach you some exercises. Yes. It doesn't ensure that you won't get lymphedema, but I can tell you blah, 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 this is your risk. It was just too funny. I'm like, what is the, okay, now I'm magic. That's great. Great. My family doctor tells all of his patients that I'm magic. I'm like, stop saying that. My daughter actually got me a magic wand for my birthday last year because I've been saying since grad school, even before I started doing this, I would say to patients, I'm like, look, my magic wand has been on back order since 1994. I don't think it's coming in this week. So we're going to have to do it this way. So I opened one of my presents and it was a magic wand. I'm like, great. Now I can't use that excuse. I'm gonna magic wand her. Yeah. Any other questions?
I noticed I had more trouble flying in the US than long distance.
Really? And that's
I
the
had-
opposite of most people.
And I mean, I wore my
Mhm.
garments. I mean, I've flown to Italy twice. I've
Mhm.
flown to Ireland.
Yep.
Had no problem. We flew to Georgia and my hands swelled
As soon as you landed or during flights?
during the flight.
Oh.
And it stayed that way. for-
Interesting.
Yeah, and the only thing somebody mentioned to me is that the cabins aren't as pressurized.
I was gonna say, I wonder if it's airplane dependent. Yes.
Yeah, as the longer,
Mhm.
it was just rather strange because I really
Which
didn't.
is interesting because the ACS guidelines always say should wear compression for long air travel, not short flights.
Well, and I did, and I mean, we even got compression socks because, you were flying for 6, 7 hours.
Yeah.
And I will say that the airline staff were very good about offering water and drinks and saying, please get up and walk around. I mean,
Yeah.
I almost kicked one because I was sound asleep. She said, you gotta get up. And it's like, oh,
Not now.
yeah, that was it. Not now. Leave me alone. But no,
I
they
got my
were,
socks on, I'm fine.
yeah, but it was rather interesting because even my other hand swelled and I had to take my rings off.
I
I
swell.
couldn't wear them the whole week. The whole
I
time
swell
we were
every
there.
flight I've ever taken. I'm a sweller.
Mhm.
I'm always like, I'm a sweller. My shoes get tight, my rings get tight. It's
Yep.
awkward. Yeah.
So anyway, I just thought I'd.
And it could be, yeah, it could be different aircrafts too. Cheaper ones.
Yeah.
Anything else?
I have a question. That's okay. So you said, women typically get 0 to 50 lymph nodes. So it might be a tricky question, but they can't get more than 50 lymph nodes? Or did I misunderstand that?
Women typically, the average, what they've
average,
said is that they've seen women who only have 5 lymph nodes under, this is non-operated women. So they just looked at how many lymph nodes do women have? And they saw as few as 5 and as many as 50 in women. So, yeah. So then they say the average is 20 to 30. Which I know they always like to average everything, but I think that complicates everything because then every woman thinks, well, I have 30 and they took 30. Well, what if you had 50? You still have some. Or what if they took 5 and you had 6? like that's the dilemma with women, because very often patients will say, but I know someone that had the exact same surgery as me and she never swelled. She didn't have the exact same surgery as you because it's not your body. They're different. You're different than she is. So there's always differences. She may have had a mastectomy. She may have had lymph nodes removed. You might have even had the same number of lymph nodes removed. But we don't know how many lymph nodes she started with and how many you started with. So there's so much difference. I think it would be nicer if they just said, you have somewhere between 5 and 50. At least then women would know, oh, so you have no idea how many I have. Correct. We have no idea without doing a test. I even asked the question, what about, I asked it at my initial training and I've asked it at advanced seminars. I'm like, so would you say, or have you looked at, some people swell really easily. Like I am one of those people. If I eat a pretzel, I can't get my rings on. With one pretzel, I just blow up. Would someone like me have fewer lymph nodes to manage the fluid balance? And they're like, we haven't seen a correlation. I'm like, oh, okay. There's a lot of.
Can I ask a question?
Of course.
I am different. Okay, I had lymph nodes removed on my left side, but I got lymphedema on my right side. Have you ever seen anything like that happen?
I have. Yes. Did you have a port?
I did. Yes, I did.
On your right side? On your right side?
Yes, it was on my right side.
The most common
I
reason
just wondered
I've seen.
because it's funny because I always tell them that they can't take my blood pressure or blood or anything out of my right arm, even though my left arm is where the lymph nodes were removed. So they've been using my left arm, and someone said to me, well, if you have lymphedema in your right arm already, you might as well just let them take it from there so you don't get it in your left arm. So it's kind of crazy.
How about your ankle? How about they use your ankle? But it would be good to find out, you might be one of those patients, one of those ladies that scars a lot. Do you still have your port or was it removed?
It was removed. It was one of the first things I did after my cancer was gone because it gave me a lot of problems.
So, yeah.
It wasn't
So
as great as I had hoped it would be. It gave me a lot of problems, and I went for 2 or 3 port studies, and it just was, I couldn't wait to get it out. So, but yeah.
Yeah. My guess is the scar tissue from that is.
I have gone for physical therapy. I was diagnosed back in 2014 with breast cancer, and then 2015 with lymphedema. And I did go through physical therapy, and I wear a sleeve, but I'm at a point now where I have trouble buying clothing, where my right arm is too tight. It's too swollen to get into the sleeve of my clothes.
Sounds like you need treatment again. It's
Yeah,
not a once and done.
I do, definitely. I know I do. And because, yeah, I do. You're absolutely right.
Yeah, sadly, once we treat you, or when someone treats you, it doesn't fix the problem. So I think there's a lot of ladies that can attest to you have to come back when you're having a flare up and see what else we can do. Do you know if they worked on your scar tissue where your port is?
I didn't have, they just did the massage therapy, and they did bandage it, and they, then it got too expensive. Like I was going 3 times a week for physical therapy, and it got too expensive. Now I work at a different company, and I have to look in to see what the insurance would cover and how expensive it would be, you know, and all of that stuff. So, but I definitely do need treatment again. That's a given. So I will. I'm on the computer, so I don't have I didn't get the handout, but I'm sure if I call BCSS, I can get your email or your phone number.
I think Raquel probably emailed you the stuff.
Yes. I
Yeah.
did. Yeah. and
If she emailed it later, so it was just tonight. So look on your emails again. I got it when I joined the email came in when I joined the call.
Oh,
So,
okay. Okay.
yeah.
Very good. Thank you.
Yeah.
But they have my contact info, so they can get it to you also.
Stacea, do they have any kind of a scholarship program or something for people who can't afford? Does Reading Hospital have anything like that?
It depends on why. Like, is it the co-pays? Yeah, we work with the social worker through the cancer center to help try to get people whatever they need if they
Good.
can't afford it.
Yeah, because it's a shame that people can't get the care they need because of finances.
And I look at people's copays. So if I would like to see somebody 3 times a week and they have a $75 copay, I'm not going to see them 3 times a week. I'm going to problem solve and make their treatment optimal 1 time a week, as few times as I can, so that I can shrink their arm down. There's Velcro thing that, you know, in addition to the Ferrorep, we have things called reduction kits that take the place of bandaging. So I have patients that just truly cannot afford to come in as often as would be ideal. We don't live in the ideal world. That's what I always tell all the therapists. I'm like, look, we don't live in the ideal world, so we have to make it work for whatever the patient can do. So we have ways, you know, if we can't get financial assistance, which usually you can apply through the billing department for actual financial assistance. So there's different ways to get it, yes. But again, we work around what is possible for the patient, and then we get good success even when my patients come once a week.
Thank you for sharing. Yeah.
Thank you.
Okay, babe, I'm going to leave.
Bye.
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 Thank you. Thank you so much. You know, every time I say, well, should I go? Because I've already heard you so many times, and then I learned something new. So I picked up 2 new things tonight, and that's worth it.
Good.
So thank you very much.
I'm always like, oh my gosh,
Awesome.
are you still listening to me?
Yeah, I know. But, you know, it's like the
Yeah,
new,
you are.
yeah, no. No, the new treatment, you know, the new way you're going to treat. And then also my gardening gloves. I wear leather gardening gloves, and I've been putting the plastic, you know, what do you call, vinyl glove underneath it, but I can't wash them. I can't wash them.
But you use a new vinyl glove every time, right?
No.
Oh.
That's what I'm saying. And I got an infection in my opposite hand that was killing me for almost 2 weeks on the hangnail. So now I know that I have to get new vinyl gloves every time. Yeah. Stupid.
That's not stupid. Don't think about it.
No, it's something, you know, I figured, well, I got rubber gloves on, but I didn't think the dirt went inside. So it did. Thank you very much, honey. Bye-bye.
You're welcome.
Bye-bye.
Bye.
Bye-bye, honey. Bye.
Bye.
keep an old glove and sleeve for
Mhm.
gardening.
Yeah.
Even though I wear gardening gloves, I always keep an old one.
Yeah, I didn't say that. You should wear compression when you are gardening if you need compression, yeah. And an old one is the best.
I wear an old one when I swim.
And on the beach, wear an old one, all the things. You're welcome.
Thank you, thank you.
Always a pleasure.
Just tell you about
I know I do too.
the little clock to Stacea. Thank you, Stacea, for being with us. So just to tell you guys of some upcoming programs that we have, May 18th, we have scam awareness with the Reading Police Department. Vanessa, our social media marketing coordinator, has been working very diligently to make sure that we can have that program for quite some time. So join us. I know a few of you are already registered.
The
You got
18th.
me.
think
The
it's a
18th, I think of
Today is. the
It is a
10th.
Wednesday,
It is,
yes.
next Wednesday.
Yes. Thank you, Stacea.
You're welcome.
Because the program committee meeting is the 19th, so that's a Thursday.
Yes.
Yeah, so Thursday, excuse me, Wednesday, May 18th, we'll have scam awareness at 6 p.m. here. And that's gonna be a series along with other programs with the Reading Police Department. So that's the first of a few. So please join us and support Vanessa as well. Then we have Face Up to Safe Beauty. I know a lot of us like, putting our makeup on and stuff. June 2nd at 6 o'clock, Pink Power Night, local doctors forum. So pretty much we're gonna have similar how we did it for the Pink Power Night in March, where we had a panel of different staff members. This will be doctors based. So we'll have doctors both from the Reading Hospital, Tower Health, and St. Joe's, basically here to answer any questions that you've been burning questions, whether it was yesterday that you thought of it or years ago that you thought of it. They'll be here at your disposal to be able to answer any questions and also go through things and questions as well that maybe other survivors have asked them. Kind of having like an informal, casual conversation with the doctors here on a panel. And then we will have creative writing. I know that's kind of a hit or miss for some people. Some people's like, some people's dislike, some people dislike it even, like to write just to do something different for a program. So that'll be beginning June 7th, every Tuesday on June 7th until June 28th at 6:30. And creative writing is only via Zoom, and Face Up to Safe Beauty is only in person, just because the physical nature of makeup and all that. So join us for those programs. I'll keep emailing, keep calling, and we've got a lot of great things coming up, a lot of events, tabled events that we'll be at. We're gonna start hitting our really busy season beginning probably like June all the way to like end of October. So join us. 5K is coming up if you want to register for that. Fashion show as well. So just let me know if you have any questions. And thank you, ladies, and thank you, Cynthia, for joining us via Zoom.
You're welcome. You're welcome. It was nice to see everybody.
On a Sunday, because I go to church, I cannot go.
The hope is to move it to a later time, once it grows a little